name's Alicia Jenkins. I'm 34, and I have a uniboob. My breasts look like Frankenstein. Before I had my son, I was probably a 36 double D. So when I breastfed, they were completely different sizes. When I decided to look for a plastic surgeon, I ended up picking a doctor that I've seen his billboards and I've seen ads, and it was a name that I just knew. I never had any doubts that he could perform the surgery.
And to be honest with you, I thought she was perfect the way she was, but I wanted her to be confident and feel like she did before, so we went ahead. She had the plastic surgery, and it obviously went bad.
My implants touch each other, which has completely lifted the skin on my sternum about 2 inches. So I have no cleavage. They call it the uniboob. My husband's main hobby is off-road racing. I found myself going with him to every race. The other wives' boobs were so big they couldn't find tops anywhere. So that was how I started my business, primarily selling bikinis, catering to large-breasted women. Perfect, perfect, perfect. And I can't even wear one myself. Smile? Yeah, perfect. It is a constant reminder that I don't look like that anymore. Stay right there, don't move. This pretty much affects everything in my life, playing with my son. Where you going, Gunner? Come here, baby. After my surgery, the pain kind of never went away. I have a lot of nerve stretching.
What you got, Bubs?
Sometimes it feels like I'm having a heart attack because it feels like there's still a lot of weight on my heart.
And then for the two of us, intimacy's kind of gone. You can't really touch her because it hurts. And then she feels like she's robbed Gunner because, you know, for months, she couldn't pick him up. She had to have help with him. And she's like hands-on with him. So I need my wife back.
I had this surgery to be better, and now I feel inferior. I really just want to be back the way I was. I just want to be normal. I just hope it's something that can be fixed.
Just think positive.
It's a lot to do again.
Alicia, doctors are ready for you.
Thank you. I was kind of nervous because I obviously had my trust in a doctor when I had my original surgery, so that's always something that's going to be in the back of my mind.
How are you? Terry Dubrow.
Nice to meet you.
Dr. Nassif.
Nice to meet you.
Have a seat. We've been looking at your photos, and we call this a symastia, where the two pockets are communicating. And this is one of, if not the most difficult things to fix in all of breast surgery.
I'm worried they can't do anything about it, do anything to fix it.
Put your hands on your hips and push. Yeah, so
Okay.
You're under the muscle for sure. Alicia's case, on a scale of 1 to 10, it's a 12. It's the most complicated you can get. Do me a favor, raise up your arms. This distance from your areola to your crease is 12 on your right, and it's 13.5 on your left. It should be about 6. Alicia has a malposition problem, which essentially means that the breast implants are way too low. And then we've got to correct the nipple positions. The other thing you need, because you had a particular type of lift called a vertical lift, you may need a scar that goes all the way across here to tighten this up. How do you feel about that? Not great, right? Listen, I know you've had a bad experience. We don't want to be part of that bad experience. We are combining our forces to do what we do the best. I didn't bring him into the fold because he's pretty, that's for sure.
We've done our homework. I mean, Alicia's been to other doctors, gotten other opinions. I think we've got the A-team now, and that's what we need.
Let's get you in a bikini feeling comfortable as soon as possible.
That's what I'm saying.
Yeah.
So, what do you think? You ready?
I'm tired of it affecting everything. It's overwhelming.
Yeah, it's another surgery. You know?
I'm not really sleeping much lately. Just really stressed. Can't really focus on anything.
But, you know, getting it fixed will be better. Better for Gunner. He'll be able to do more things and hopefully not be hurting all the time.
I just hope it doesn't take me long to get through it so I can hold my kid.
She's been extremely emotional over things that normally wouldn't hurt her feelings that she'd be able to brush off her back. I pretty much just deal with things inside and stay strong and let time fix things. And she used to be along with me. You know, we don't talk about those things. I mean, it's been hard on me, it's been hard on Gunner, it's been extremely hard on you.
I know it's been really hard on him, you know, with the first surgery, coming home from a hard day of work to taking care of our son and all the things that I normally do, he had to do, and then help me take a bath and help me go to the bathroom.
I'm really looking forward to having you be able to do the things you want to do and be the mom you want to be and be happy when you wake up. Look forward to the next day. She feels really bad because she chose to do this. She can't even look at herself in the mirror. You know, you start thinking about those things, and that's pretty hard. That'd be a pretty hard thing to live with, I think. And hopefully the super mom comes back, because now it's been super dad.
Like having to depend on other people to do everything for me.
Hopefully going through it fixes it. In a marriage, your relationship has to be number one. And as long as both parties are on the same page, you can get through anything. And we're working on getting through this, you know? How's it going?
How you doing? There's something really important I have to talk to you about. I got the records for your previous doctor. Normally, I don't change the plans the day of surgery, but I got some information that led me to alter what I wanted to do. The surgery that was done was much more extensive than I thought. I know it looks really bad, but it's actually even worse inside. It's really important that we take these implants out and leave them out for a few months. To allow everything to heal down and not have this problem recur. Because this is the worst case of this I've ever seen.
I was shocked when Dr. Dubrow told us it would have to be done in 2 separate procedures. You know, this affects my entire life. I just want it to be over with.
If everything goes according to plan, I do a bunch of procedures today and then come back in several weeks and put a pair of implants back in. The biggest potential problem is that the entire repair breaks down and she's back to square one. Totally makes sense, doesn't it?
Yeah. Not excited about it.
Fun. No. No.
It's gonna be a long road here, but what choice do we have? You know, I have to hope that these guys are as good as they say they are.
I'm telling you, this is not only the best hope, this is the only hope. The solution sucks, but so does the problem.
Yeah.
But I think it's probably necessary.
Yeah. I was very pleased that Alicia agreed to the 2-part surgery, but unfortunately that means 2 recoveries, 2 sets of goals and expectations. It's a lot to go through. Repair of synmasty is the most difficult thing to do in all of breast surgery. So what the plan today is I'm going to access these implants through 2 incisions at the bottom of the areola on each side. I'm then going to take the implants out, then sew down this skin to the chest wall, and then allow this to heal and come back in a couple months and put a pair of implants in. Okay, let's get started.
Let's do it.
Okay, so we start with an inferior areolar incision, which basically means an incision at the bottom of the areola. Boy, these are incredibly big implants.
What size are they?
I think they're 600.
Wow.
Too big.
Way too big. Looking inside of her right breast pocket, I can see into her left chest.
No way.
Yep. So we're gonna suture down the breast pocket. I basically have to sew all the tissue overlying the center of the chest. If I get too close to the chest wall, I can get into the lung. Sewing down breast tissue, good. Puncturing lung,
Bad.
bad. Oh, hold steady, hold steady. Do not move. She has a normal breast implant pocket now that's just here, 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 and here. I'm just curious as to the exact dimension of the pocket I've created. The reason you put in air size is to check the status and position of your pocket. So you work with a temporary implant that allows you to assess what additional procedures might need to be done.
Looks really good.
I mean, look at that. It actually is perfect. So I've restored her to normal anatomy right now. Unfortunately, I can't leave this implant in. I have to let everything heal because the damage was that extensive.
Thank you. Today, I'm in a lot of pain. The tissue feels like I got run over. Okay.
Hey, guys.
Hi.
How are you?
I'm sore.
Yeah?
Pretty good, though.
Really?
Yeah.
A lot better than last time.
Nothing is more painful than putting stitches in muscles and ribs. And it's incredible that Alicia didn't have more pain.
Looks like you still got boobs to me.
Baby boobs.
Crazy.
Just relax.
I'm very concerned about the size of my breasts. I definitely don't want them too small.
Yeah, see how they're in perfect position? And this is separated? Don't they look better?
They do to me.
Yeah, right?
Wow. I haven't been this flat-chested since I was in the 6th grade. I'm not used to it. It's not really comfortable for me. What are we doing? We're doing the implants and...
We have to figure out what size to make you because you had really big implants in there. 600 cc implants in someone who has breast tissue like you is gigantic.
Alicia's concern with the size has definitely been an issue through this whole thing, and it's just ridiculous because she has big boobs already, as far as I'm concerned. I mean, when I first met her, I thought she had implants because of the bra she wore.
I know you wanted something on the order of a 500 cc, but that won't be that much smaller. 60 cc is a shot glass, so 100 cc smaller is still very big.
Baby boobs.
Should I be offended by Alicia's bratty behavior? Maybe. You know, this is a work in process to fix a really difficult problem. I think she should show a little more appreciation for what we're trying to do together. This is what I took out of you.
It is?
Yes, this is it.
Holy crap. That is so heavy.
A little ridiculous. The implant size alone was ridiculous. I mean, a little heavier than a grapefruit, the size of a grapefruit. That's crazy, crazy.
You just don't need anything that size. I mean, when you put a 600 on the table, that's a D. On you, it's a triple D, because you have breast tissue already.
I wouldn't go smaller and feel comfortable just because it's what I've always been. It's what I know.
To try it on, I put in a 350, and let me show you what it looked like. Isn't that pretty? I mean, I'd buy that Playboy. I often take photos of patients to show them what their results will look like in the long run. It's really all about managing their expectations. Because that's big enough, right?
What cup size would that make me?
Small double D, and small double D is big enough. Alicia is so afraid of seeing her breasts smaller that she's forgotten how big implants got her in trouble in the first place.
I don't know, it looked pretty good like that.
Looks like they did before.
No, that's bigger.
Well, at least I'll have 2 and not 1. Right. I'm so excited I can't contain myself.
That's good.
It's been 5 weeks since my last surgery. I can't wait for it to be done and over with, and I'm expecting to be on the smaller side of what I really want. It's something that I've had to come to terms with because the larger they are, the more likely this is going to come back.
And we run around the backyard in no time, chasing the boy.
Hi, Alicia.
Yep.
Hi, my name is Ozzy. I'm gonna be your nurse today.
All right.
We're gonna put the implants back in now, but what got her into trouble the first time was going way too big.
Too big, and that's what stretched out and opened up the chest.
Yes. She settled on 400 cc's, which is not nearly what she was before. She was in the 6s before.
I mean, that's not gonna cause a problem, though, with that?
Well, I mean, there is the risk that all of her problems could come back. The second surgery is a lot more simple than the first surgery, but a lot scarier because there's a lot more at stake. Okay, so we'll make the incision and see what the repair looks like.
How far are you going down?
All the way, baby. Everything looks really good. So we're gonna go down and make a pocket that we can put these 400 cc implants in. You have to be really, really careful about lifting this tissue up, because the last thing I want to do is give her the same problem again that she started with.
Today, I finally get to shoot a campaign for my business, Dirt Dames, with me as the model, not someone else, me. I had nothing that fit. I didn't feel good about myself. I went through hell to be where I am right now. I have been waiting and waiting and waiting for this day, and I can't believe it's finally here. My My friends and family are here to see me in a bikini for the first time, and I can't wait to show everyone and see their reactions.
Alicia's breasts look amazing. She looks so great, and you could see the confidence in her.
Don't make me cry.
The doctor that did it, he did a phenomenal job.
Hi.
They're pretty amazing. I think they're perfect. They're what they should have been the first time, and Dr. Dubrow did an amazing job. She's finally got what she wants. Hopefully here soon I'll get to, check them out a little better.
I'm Isaac, photographer.
Hi.
Nice to finally meet you.
Nice to meet you too.
Looking forward to the shoot today. You guys ready?
Too. Yeah.
All right, let's do this.
Yay. A dream of mine has always been to shoot with Isaac Madera. He's an amazing photographer. Girls with the tattoos and the magazine covers and all of that, that's like the top of the line for the business that we're in.
Turn your shoulders towards me now just a little bit more.
So now to be shooting with him means a lot more to me than it ever did because of everything that I've been through.
To see her stand here and do what she was doing with a smile on her face and feel good about it, that's the girl I married. I'm very happy. Good job.
Thanks.
That's great.
Thanks. How does it look?
You look amazing.
Before I had a uniboob, my implants were hanging out the bottom, and that forced my nipples to point up and out. And now I have no pain. My breasts are perfect. They're exactly where they're supposed to be. They're perfect. How I feel on the inside is exactly how I look on the outside. Dr. Dubrow gave me back.
You did good. You look great.
Everybody's looking at my boobs.
Everybody's looking at your boobs.
I'm Janice Dickinson. I am the world's first supermodel. I did French Vogue, Italian Vogue, Mexican Vogue, Vogue. You name it, I've been on the cover of every magazine in every world for every season. I am no stranger to plastic surgery. I've had a facelift, a brow lift, tummy tuck, and fillers. I'm perfect, except for my When I was reigning as a supermodel, I had very small A's, and designers loved that. I was 32 when I had my first implants. They didn't feel like breasts. They felt wooden. One went in one direction and one went in the other direction. But I was happy because my breasts finally fit into a brassiere. I wanted to have softer breasts, so I went from saline to silicone. Sylvester Stallone paid for those, so I figured, why not? Free I'm in. After the second surgery, they started to get ridges. It was like canyon ripples. I did American Idol, and I wore something extremely low cut, and I got dogged the next day globally because they zoomed in on my breast, and you saw the ridges and the ripples. I should have worn a wetsuit. Hi.
Hi. Hi.
I'm Janice Dickinson.
Amanda.
How do you do?
Good. Nice to meet you.
My friend Steven.
Hi.
Hello, very nice to meet you. How you doing?
We have several outfits that we need for Fashion Week in New York, Fashion Week in Paris. But the thing of it is that I have tricky breasts. When I stand in front of the mirror naked, I always see the ridges.
We have full racks here for you.
I'm gonna have a full rack after I get my boobies done. The red carpet is the red carpet. People critique it. They write about it in fashion magazines. They talk about it on Fashion Police. They talk about it everywhere. Oh my God, it's Versace. I was the original model when Gianni Versace first designed the metal dress back in 1978.
Oh my gosh, that's amazing.
I know, I love Versace, may he rest in peace. I don't want rock star. I wanted them to look appropriate for a woman my age.
I'm not discussing it, just like
No, I know, but I can't walk around and hold my breasts like that all day long.
No.
Hopefully, with the help of Dr. Dubrow, I can have my wishes and dreams come true. Because if he does, I'll his
This is something a little bit different. Do you know who Janice Dickinson is?
Of course.
First supermodel?
Yeah, and she's already
Right.
actually had a good amount of work done. Well,
I am
hello.
Janice.
Wow.
Janice Steven, which is which?
I don't know. It's a good question.
Janice. Hi. How are you?
How do you do?
Dr. Nice to meet
Pleasure.
you.
Dr. Nassif.
Heard
how
so
are
many
you?
great things about you guys.
Really? We'd like to hear
Yes.
that. Please have a seat.
Yay. Hopefully, you can help me with my breast.
What bothers you most about your breasts?
My silicone breasts have been in there for about 30 years. Yes.
When you get your breasts done, you're really supposed to have them replaced every sort of 10 to 15 years. Implants that are more than 13 years old have an 83% chance of being ruptured. These implants being from the 70s, who knows? We may take them out, put them on there might be streaks of cocaine still left on them.
I feel like that there are particles that are rolling around that, like the size of edamame.
The good news is you were done the old-fashioned way, which is to put those old...
Stop saying old.
Those...
antiquated or
antiquated. You had the other silicone implants put in on top of the muscle. That was the other way that was done previously. Theoretically, we would take those implants out and then lift up your pectoralis major muscle, peeling it off the ribs. And then lining the inside of the breast pocket with them so that the new implants go under the muscle.
Well, I'll be under anesthesia, right?
Yeah.
I don't take narcotics, but
You don't take any narcotics?
well, I'm gonna have to take narcotics for this, but you know, I'm sober. I have had drug and alcohol issues in the past. I'm nervous about doing this operation sober without taking pills to calm my nerves and my anxiety. So there's like, you know, I'll go to a recovery center and that'll be good.
You'll be good.
We'll just work within my program of finding the easiest, softest way we can go through this operation.
Let's go in the other room and have a look, okay?
Okay.
Hi.
Uh-oh, she's in the right gown there. Perfect.
Okay, so show us what's going on.
See the ripples?
Oh, yeah.
See the ridges?
This is the actual implant. As you know, these are the ridges in the implant.
Really?
Yeah.
So the skin's getting a little thin.
The skin is getting very thin.
My skin is thin.
And your implants are almost touching in the middle. Janice's breasts have a lot of problems. She's been in need of breast surgery for probably 2 decades now. The implant pockets are sharing a space, and you have what's called symastia or called bread loafing, where it's like a bread loaf in the center.
Like you could feel like deposits floating around. There's like an edamame.
It's edamame, Janice. Edamame. Let me tell you what the options are. Ready? Number 1, we can take cadaver skin and sew the inside.
No cadaver skin! No dead bones of ghosts, no serial killer ladies that have been in jail, no.
The other option is to make the incisions underneath the areola, the way you have those.
Yeah.
Okay, go in the same opening. Take the implants out, lift up the muscle on each side, extremely painful.
I won't do
Elephant
it.
on your chest kind of recovery.
I don't want an elephant on my chest.
I know, but that's
Why
what it's
do you
gonna
have to
feel
be like
like.
that?
She's had some problems that she admits to with narcotics in the past, so I'm not sure how we're gonna get control of her pain post-operatively. Putting the implants under the muscle will do 2 great things for us. 1, it should get rid of, if not all, most of the rippling, number 1. Number 2, it'll separate the mounds and stop you from having that symastia, that bread loafing. The question for Janice will be, can I fit the same size implants under her muscle? And she wakes up with smaller breasts with a more normal breast shape. Is she gonna be happy? Only time will tell. This is the operation of choice.
Sounds like a plan.
These implants are, forgive me,
Don't say old.
ancient.
I need them out.
You need them out.
You're getting caught. You're getting fixed.
To be honest with you guys, I'm really nervous about it. He said under the muscle. That would be like lifting up like your balls
Oh, no, yeah,
and
yeah,
sticking
yeah.
something inside and then sewing your balls back on. This will be the first time I'm having an operation without medding myself out because I'm sober. Before, I took anti-anxiety pills like crazy and nothing affected me.
But you're gonna be fine. You're gonna like take the meds as prescribed. I know, exactly.
But as prescribed.
Right.
No, I don't do that because Rocky won't let me. Speaking of the devil.
Tony,
How are
Hello,
you?
Angel.
Mwah. Lovely to see you, Rocky.
I will. Now you have lipstick everywhere.
You work
Sit
too
down.
hard. Your girl's been very nervous all day. We're trying to calm her down.
I'm feeling sober feelings as opposed to
Normal feelings.
pop the pills.
Normal anxiety.
Normal anxiety, doctor.
It'll be okay. I'll be right there. I was really glad to hear that Janice was anxious because she was sober and could feel her real feelings.
It's about growing gracefully. Make them healthy and beautiful
Yes.
and perfect.
The gays love my breasts.
True. That's personality, honey. That's not breasts.
And it's the fact that you have breasts that makes you interesting.
Stephen,
Yes.
I'm giving you the old implant.
Well, I'm going to put them on eBay.
I love Janice the way she is. I could see she's been bothered. I really am looking forward to her feeling more comfortable with her appearance and her body.
What if no one hires me again?
Of course they will.
What if Rocky won't love me anymore?
Of course he will.
What if the dog won't play ball with me? You know, I'm pathetic right now. Thank you. Hello.
Hi, Janice.
How are you?
How are you?
This is an extremely new experience for me. I've had surgeries done in the past, but not quite as sober as I am today. And thanks for taking your day off from work.
Where else would I be?
The races.
This line is you.
The strip clubs.
Janice?
Hi.
Hi, my name is Ozzy. I'm gonna be your nurse
Hi, Ozzy.
today.
How are you? Good.
How are you?
Awesome.
I can take you back.
Thank you.
You're going to be fine.
I know.
We're gonna take good care of you.
I
Come on
know.
back.
Thank you. Bye, Rocky.
Wow.
I'm a little scared. It's an enormous challenge to manage someone's post-operative pain who has a history of narcotic addiction. So we may be in for a real wild ride with her.
Can I please have some Valium right now? I'm nervous. I'm nervous.
You have to watch her very closely because she will either be very resistant to pain medication and want a lot more, or she won't want to take any at all and will be in a great deal of pain.
The question is, are these ruptured?
I don't know.
Plus you have this little mass here.
Mm-hmm.
So, possible breast biopsy, right breast.
It's the edamame.
Edamame.
While you're at it, do something to my vag.
I like Janice, but she's a challenging patient for many reasons. She doesn't give you exactly an accurate history. The other challenge will be managing her post-operative pain.
Anything you feel like having, cocktail-wise?
I'm in AA. Of course I don't want a cocktail. I'm anxious. I'm nervous. I don't really know what to expect about the breast pain that I may be feeling. And I'm an addict. Anything that isn't doctor prescribed, that's when addiction kicks in. Do it.
All right. Start thinking of a nice place to go on a little vacation.
Happy thoughts.
For Janice's surgery, we're first going to remove her old implants. Then we'll remove the masses from the right breast for further testing, and I'll finish by putting in 2 new implants under the muscle. Okay, so first thing that we're gonna do is go ahead and make an incision in the right areola and go down and see what the implant looks like. You have to be really careful because if it's ruptured, it'll come spewing out. It's not ruptured, which is good and rare. It's so old that all the writing's been worn off it. I couldn't tell how large they were, and they were a little bit gooey, which is evidence of a micro rupture. We've washed out the pocket. Let's look at that breast mass. Once I got inside, I could feel those masses better, and they were quite large, and they need to come out. There's another one. So here are 2 little breast masses we found. One is an enlarged lymph node for sure. The function of the lymph nodes is to do surveillance and to remove toxins and cancers and bad things. You don't want to clog them up. So we need to send this off to pathology and see if there's anything that we need to worry about. There could be a number of things in here, including breast cancer. This is the part that's going to give her all her post-operative pain. So I'm going to do Janice and myself a favor and numb her up with a lot of long-acting numbing medicine to try to keep her as pain-free as possible post-op. Does not want to come off. Because of the inflammation, the muscles were very tight surrounding the implants. So I need to do a careful release to allow them to look like normal breasts and for them to be comfortable in there. Okay, so we're putting in a new pair of implants that are not decades old, that are of a thicker generation of silicone envelope and have a little more projection to them. A similar sized implant compared to what she had before. That muscle feels really tight. All right, let's put the other one in. Can we have the other one? So I'm going to close off the old pocket to prevent the implants from popping back into the on top of the muscle position and keep them under the muscle. All right, let's sit her up. So are there any improvements at all we can make at this point?
You look really good.
Actually, they're pretty good. Let's put her down. Let's close her.
I'm scared of recovery.
Oh, man. I love Janice. Janice is the greatest patient when she's in a chemical coma. What I'm concerned about is once she wakes up, are we gonna meet the happy-go-lucky Janice? Are we gonna meet the ex-addict Janice? I have no idea.
Look at you. You look amazing. Just one day out of surgery, you look incredible.
I hear what you're saying,
Okay, Janice, let's do some pictures.
but it's not computing.
How are you?
I feel that I should have been left longer at the recovery place.
Where's your dress? Who took your dressing off?
I did.
What is this?
The drain from my boobs.
You took your drain out? Kill me. This is so dangerous, Janice.
Oh my God, well, I'm sorry, so sue me.
I asked her
No, I'm not gonna sue you,
All
but...
right, it's not about you.
Well, the problem with this is a sterile thing that goes inside.
So it's still sterile.
No, because this is, ay. Once you disconnect the tube from the bulb, you've contaminated the entire thing, and bacteria can crawl up the tube into your breast pocket and cause an infection.
Did I up?
I've never had a patient do this before. Are you trying to have a disaster on me? Don't do that.
No.
Look at all that fluid. Well, you cut the stitch here, and see, now you're bleeding over here. You're doing things that could turn into a big problem.
You didn't tell me not to take it off.
Right, that's true, but I also didn't tell you, not to jump out of an airplane, but you're not gonna do that either, right?
Oh my God, all right, enough.
In my 25 years of being a board-certified plastic surgeon, Janice is by far the most difficult patient I've ever had. She is her breast's worst enemy. I'm gonna wrap you up so that no matter what you do, you can't touch these incisions anymore.
It's not the incisions I did it on. I did it on...
You just touched the incisions in front of me.
What, those?
Yeah, those.
If you would give me something for the pain, doctor, please.
You just spent 3 days in the hospital on IV Dilaudid. Most people are on aspirin by this point.
I don't give a about most people. That's nice for them. You're gonna have to give me something. I'm serious. I don't want to feel this bad.
The ex-addict is coming out, and we've got post-operative pain management problems. I'm kind of at a loss how to deal with her right now.
It hurts to blow my nose. It hurts to take a I'm in a lot of agony. So I want to be prescribed for 2 or 3 days the same that I had at the hospital.
This is classic drug-seeking behavior. So let me tell you why this one hurts more than that one. You know you had those masses up here.
The edamame.
I took one of them out. It was like a calcification, like the type you have when you have breast cancer, but it wasn't a breast cancer. It will not be a breast cancer. It's just a reaction to the little micro rupture of the silicone, okay? Thankfully, they're benign. They needed to come out, but they're benign. And it's all gone. So,
thank you.
So I have brought you a fresh bra that I'm gonna put you in.
Is it black?
Black surgical bras?
Yeah.
No. This isn't the Victoria's Secret's lingerie catalog. This is recovery. Get it together. But I mean, you're gonna go out?
Yeah, I have to work.
You're going out tonight?
Of course.
With drains in place?
Yeah, she needs to be seen. She needs to show
Seen
off.
with drains and narcotics on board? You had breast tumor excision. You had 4.5 hours of reconstructive surgery. Can I talk turkey with you for a second?
Yeah.
Can I be a little? Can I be a little brutal?
Be real.
Can I be a little brutal? You're gonna this up. If you keep acting like this, you're gonna it up. You're gonna get a complication, and you're gonna lose both breast implants. I'm not kidding. I need Janice to have a come to Jesus moment and realize she is dangerous to herself and her breasts. Don't take this question wrong, but why do you smell like cigarettes?
Well, Steven smokes.
It's me, yes, I smoked.
Have you been smoking?
I have not been smoking.
Has she been smoking?
No, she has not.
Why do you say it like that? Did you smoke a cigarette today?
Did you smoke, Janice? Because I didn't see you smoking.
Did you smoke a cigarette today? You did smoke a cigarette today. All of these things could lead to a serious infection, which could land her in the intensive care unit, require emergency surgery, and be honest with you, could kill her. Right now, I've got you in a great spot anatomically.
I'm so happy.
Just wait. This is the worst they're gonna look.
I just have to tell you the pain I'm in right now, so you can get out your little whippersnapper.
All right.
You know, script pad.
She has Percocet at home and Valium.
Yes.
Yes?
Yes.
Yes, I need to take one now.
I physically don't have any.
Okay.
I'm not a pharmacy. I don't carry pain pills with me. That's not what doctors do.
Could she go to the gym?
No, she can't go to the gym.
Oh, I can't pull my pants up. I'm sorry.
No, you can't go to a club or a gym or the beach or Hawaii. Go home.
Okay.
Be normal.
How the am I gonna hide these drains?
What do you need to hide them from? Where are you going?
Where's my t-shirt?
You're not going anywhere, Janice. I have two major fears with Janice. One, that her narcotic use is gonna be out of control and she's gonna be found dead in her bed. And two, she's gonna contaminate her wounds so much that she develops a breast implant infection. I have to take them out in the middle of the night and she's weirdly gonna blame me for it.
Hello?
How are you?
Good, how are you?
Good, how are you?
I have no recollection of last week at all.
Nothing.
Look, whatever I said, however I behaved, I'm very sorry. It's not me, it was the meds. It just was the meds. I'm sorry, it was the meds. I didn't know if I broke my sobriety.
That doesn't count.
It doesn't count because I was under doctor's orders.
Well, you had surgery. I mean,
yeah.
You went through a lot. That was a big
We went
week.
through a lot.
We went through a lot.
What did we do?
You were a little bit...
discombobulated.
That's a good word. I'll go with that.
Were you breastfed as a child?
You know what? I wasn't breastfed.
See,
Maybe that's why...
You're fascinated with my... I knew it.
Well, you know when you're just coming into your own as a kid?
Yeah.
All I saw were breasts.
Where?
Everywhere. Every girl is just breast.
You just
breast,
were
I'm just like a breast freak. So I became a breast freak. Not bad.
Get over here, big guy.
You know what's cool? You had some redness at the end of the procedure, and it got worse over the next few days just because of all the surgery I did. It's gone. You are surviving your discombobulated-ness.
I have a great doctor. You completely fixed a botched surgery.
Yeah, no, it's good. All right, let's put this back on. Let's put it on. When was the last time you looked this good?
Seriously?
Since my ex-mother-in-law fell in the well.
All right.
I will rock
All
these.
All right. Bye, sweetie.
Today's a really big day for me. I'm shooting my own campaign for a new skincare that I'm launching called The Answer.
I'm so excited.
I'm gonna go and get her and see what she...
Well, so you can see for yourself, yeah?
Okay,
excited?
yes. It's really great to have recovered out of this whole experience with Dr. Terry Dubrow, to be back on my feet, looking better than ever, feeling better than ever, back on the bike again. House of Janice.
Hello. Ah, bella. Sei bellissima. You look very nice.
I'm gonna have to apologize to Rocky. I just had some thoughts about you.
Finally. I love you so much. Love you more. Before the surgery, my breasts had rippling and they met all the way together that I looked like I had a uniboob. Today, they're perfect.
Oh, beautiful. Yes. Bellissima. Fammi vedere le tette.
I will be going to the beach and putting on the skimpiest bikinis I can get my hot little hands on, and I challenge the paparazzi to take pictures of them and try to find fault in them. I can't wait to get on a pogo stick naked and just bounce up and down. My boobs look great. Should we do a nude?
Let's do a nude.
Stephen, darling, taste the nude. Woo!
Ce l'ho,
Woo! Yeah,
Grande, cazzo, grande. Un mito.
I'm Kimber James, and by the age of 23, I had 24 plastic surgeries. I've had 2 brow lifts, 2 brow bone shavings, hairline reduction, 4 rhinoplasties, my ears pinned back, an upper lip lift, a lower lip reduction, a jaw reduction, chin shaved down twice, lower neck lift, neck lipo, a tracheal shave, 5 breast surgeries. 3 were augmentations, 2 were corrective. I definitely look back and think I really shouldn't have done a lot of the surgeries I've done, but I got caught up and I just probably went a bit too far. I started with breast augmentations when I was 17. I've had issues every single time. And now I'm just Ripple Central. Everyone knows I've had a nose job the minute they look at my face.
You just look expensive.
But I want to look natural.
Is that possible?
At 15, I had my first nose job, totally botched, and now I've had 3 more to correct it. And I'm still not happy, and it's not just because I'm not satisfied, it's a mess. I've had to take cartilage from both ears to repair. I can't really breathe that well. It's why I sound so nasal. I hate when people make nasty comments. I'm over it. I feel like I'm just a walking mistake. I want to be more natural. I want to be more toned down. I want to feel more like a woman and look more like a woman.
You look expensive.
I had my sex change a year and a half ago. I told him I wanted to look like I was 13 and never been touched before. My vagina looks like a baseball glove. I was the first transsexual to sign with an adult agency, but I'm really at the point now where I'm working my way out of porn. It's time for me to move on. I don't understand how you have a virginal-looking vagina after all the damage it's seen.
How'd you have a good time?
I feel like the doctor gave me no inner lip. He only gave me outer, and the outer lips are not tight. They hang too low. It doesn't look like a vagina to me. I really feel like once this is done, no more plastic surgery.
I'm really hoping so.
I just want to meet a nice, normal guy, have the white picket fence, but I don't necessarily think it will really happen for me. I think I had come with a lot of baggage.
The next patient is Kimber James, who is a transgender from male to female. She needs a revision of her nose, which is she's had multiple surgeries. I'm gonna do, with your help, a revision of her breasts, and then she looks like she has a complicated vaginal labial reconstructive need, right?
Correct.
Yeah.
Correct.
In a very complicated case like this, we need to bring in a world's expert. Dr. Alter basically is the wizard of vaginas. He's a vagina whisperer. When you undergo transgender male to female surgery, do you have to learn how to fake an orgasm the way my wife does?
Terry has a subtle penis syndrome.
That's better than micro penis syndrome like you have.
Hi, Kimber.
Hi, how are you?
Good.
Terry Dubrow, nice to meet
Hi.
you. I'm not familiar with Kimber James's work. I bet you Paul is.
This is Dr. Alter.
Nice
to meet
Dr.
you.
Alter.
Who's this young lady?
This is my best friend, Danielle.
Hi.
So we've been talking about you behind your back, obviously, in a positive way. And we've been talking about all 3 different types of surgeries, from the nose to the breast, and then down in the vaginal region.
Right.
Start off with your breasts.
Well, I've had 5 surgeries. Now I'm 1,000 cc's.
1,000 cc's is like 2 quarts of milk, right?
I pay every day for it.
So now you feel you're too big.
Yeah, I mean, like, I'd like to go down to like 800.
Right.
When we get a patient that has had many plastic surgeries and gone to the extreme, it's usually a red flag for us. But in Kimber's case, she's asking us to make her look more natural. So that's something we're okay with.
What's going on with your nose?
It just looks very nose jobby. It looks like it's a fake nose.
When you overdo a nose and take out too much tip cartilage, the tip starts to shorten and lift back, it loses projection, and the nostrils get really retracted or pulled back. This is a sign of over-aggressive surgery. But now for our final part.
Vagina.
So right now, what bothers you?
I'd rather be tighter, more virginal looking, and
Well, that is a little unrealistic, okay? Plus, we have videos proving.
I know.
But,
Danielle has the perfect vagina, and I want hers. As close as we can get to it. So I want to have twin vaginas.
I know what a vagina looks like.
It's not necessary.
Well, you don't think I should go with that one?
Yeah, it's good. Who does that?
We need to examine you.
Gotcha. Hello. That's my little medical team. I'm not having the surgeries to better my career. I'm having the surgeries to better myself. I don't want people to stare at me on the street. I just want to calm things down.
Okay. You know, the biggest issue with operating on Kimber's nose is the elasticity of the skin. There's not a lot of movement. Now, the thing is, we're not going to hit a home run on this. This is going to be a double or triple.
No Michael Jackson.
No Michael.
Okay.
No, better not be.
I've been to countless amounts of plastic surgeons that have just said absolutely nothing can be done. I'm in complete and utter shock that Dr. Nassif can give me any hope of any improvement.
So let's take a look at the chest area. Okay, so, you know, the first thing that stands out to me is that they're very large, right?
That stands out to everyone. Yeah.
Right, and you can see the saline bag, the ripples. We call this wrinkling or rippling, right? So we want to improve that. My plan, if it sounds okay to you, would be I put a smaller pair of silicones in and close up the pocket around them and try to improve the shape. Saline is essentially salt water. It's a water bag. You can feel the water in there. Silicone is a gel-like material that looks and feels like an actual breast. So silicone is almost always preferred in patients. I think that will hit a lot of goals. So last but not least.
Dr. Alter.
So I make a little incision here, and here's your clitoris. So if I can cover that up a little bit more like so it's not as obvious, okay?
The normal anatomy of the vagina is that you have outer lips, inner lips, a clitoris, and a clitoral hood. In Kimber's case, she doesn't have inner lips, nor does she have a clitoral hood. Dr. Alter is going to make her inner lips here, and create a clitoral hood to cover her exposed clitoris. This will give her a more natural appearing female vagina. Are you excited about this plan?
I'm so excited. After I have all these surgeries and I'm fully recovered, I'm gonna go out there and I'm gonna find my simple Southern man, have my 3 children, and call it a day. And you can say goodbye to these. Bye! I can't wait to have babies. I love popping in and out of baby stores sometimes. Maybe I'll see something cool and then eventually I'll have a kid and they may not make that 5 or 10 years later. So I found this. If I buy it, even if I don't have a girl or a baby at all, I won't have wasted my money because it fits.
Oh my God.
Sienna styling.
You are.
I'm gorge, right?
Yeah, that's for a pretty big baby.
Sometimes I wonder if it'll ever actually happen for me. I want big, strong, hardy boys that aren't afraid to wear pink. When I had my surgeries done, I'll feel maybe more myself. I won't feel like a product. Oh, look how cute.
The baby carriage?
I know. Should I have my gestational carrier have like twins? That way it's just, I'm saving time.
Yeah.
And I can get like a double.
I don't think you'd be able to handle 2 babies at once, though.
I'd have nannies.
Let's hope so. I can just see you pulling your hair out right about now.
I want to come off the way that I feel on the inside. Maybe that'll help me find the right man and get myself more in a position to be where I want to be in life.
We'll be back here again, I'm sure.
Hopefully. Hi, I'm checking in for surgery.
Okay, great. You can sign in and we'll take you back shortly.
All right. I'm feeling a little anxious. Today I'm having 3 surgeries. I'm having a revisional rhinoplasty, my breast reduced, and I'm having a labiaplasty.
Your boobs, I feel like they change all the time. I can never tell if they're up or down. I know they're huge.
Even when you think they're small, they're big.
Well, I don't think they're small right now.
I know, thank God.
I can't wait till they go down a little bit.
How much smaller are you getting?
200 cc's. After I have all these surgeries and I'm fully recovered, I won't look in the mirror every day and think, what did I do to myself? I have to go down gradually because if I go down too much, I'll shock myself. And you know me, I'll be like, oh, and then I'll go get bigger again.
I know, and that's the last thing we want.
Right.
Ease your way into small.
Right.
Kimber? Hi.
Hi.
My name is Ozzy. I'm gonna be your nurse today. Okay, I'm gonna take you back. Come on.
All right.
Bye. Group hug. I know. You're gonna go right here.
Can I have my old implants back?
Yes. What do you want to do with them?
Sell them.
You want to sell them? What, on eBay?
No, my website.
Oh, really?
Yeah, they bought my last set.
What'd they buy them for?
5,000.
5,000? Wow. It's not a bad idea. There may be a side business there for us.
Big deep breath, Marcia. Milk of amnesia.
Night-night, Kimber. I'm going to start by reducing Kimber's breasts from her large 1,000cc implants to a much more modest 800cc's. Then Dr. Nassif is going to use skin and cartilage from Kimber's ear to lengthen her nose. Finally, Dr. Alter is going to reshape Kimber's vagina to give her a much more natural look. We're doing the breast first because it's the most sterile procedure because of the silicone implants. You don't want to get any bacteria around those implants for fear of an infection. These implants are so big that given time, they can easily wear their way through the skin and come out.
And become exposed?
Yes. Biggest problem that I might face with Kimber's breast is that her skin is very thin, therefore the blood supply to the nipple isn't very good. When the blood supply to the nipple is impaired, it undergoes a process called necrosis. It just dies and falls off. Not a good situation. It's basically zombie breasts. Okay, we're gonna start by taking out these implants. Look, these implants are upside down.
Here, let's get the suction on.
Look at this. So, whoa.
Oh my goodness.
So that's what, she's basically skin on chest wall. So it's supposed to be like this. She was like this. So this is also an 800cc implant that's been overinflated.
Interesting. She has no
breast tissue.
Chest fat at all.
No chest fat, no breast tissue, nothing. Because she was formerly a man. You don't have the usual kind of coverage you do over the implant.
While Dr. Terry works on the breast, I'm going to take a piece of skin and cartilage from the ear, which will be used to line the inside of the nostrils. Essentially, that will just lower the nostrils. The biggest issue with Kimber's nose is that her nostrils were lifted up too much. You can see inside of her nose. And she had tight nasal skin. So I did not know if I was gonna be able to extend her nose. So this is the composite graft. It's made out of skin on this side, cartilage on this side. And this will be used to align the inside of her nostrils.
Paul, what are you doing now?
I took a composite graft from the left ear.
Because her skin is so thin, and it shows what we call rippling through the skin, where you can actually see the folds of the implant, we're gonna sew in a piece of mesh to reinforce the skin. What are you trying to get?
Let me have a rag now.
All right, can we sit her up?
No. Yeah.
Paul, look at the rippling here.
They look remarkable. You did an amazing job.
Thank you. With time, tissue will grow in and thicken up this skin and make these better, safer breasts to have. I think they're smaller, they're reinforced, they're safer. She should be really happy.
And now we're trying to lengthen Kimber's nose through a closed technique. I'm going through a lot of scar tissue. You know, since I wasn't doing a lot of work up in the middle part of the nose or around the tip, I did not have to do an open rhinoplasty, which means only the incisions are made inside the nose. There's no visible external scar right here. Dr. Alter, how's it going down there?
Going great. Kimber's clitoris had too much of her clitoris showing, so I extended the length of her clitoral hood so that it covered more of her clitoris, which will make her look much more normal. She'll still be able to get access, so it's not going to interfere at all with sensation.
Okay, guys, we're finished. We're able to lower her nose about 5 millimeters, lower her nostrils. This is going to be exactly what she wanted. It looks great. All right, guys, thank you. put a little cast on and tape it up and we're all set. In Kimber's situation, I was able to improve and lengthen her nostrils, but by no means are they perfectly symmetric. Okay, Dr. Alter, how you doing over there?
Just about done. I finished the clitoral hood. I'm just about done with her inner lips. She's got much better definition of her labia minora. She's gonna look much more normal and she's gonna be much more confident about her appearance here. So I'm very happy. I think she looks fantastic.
Well, that's why we had you. You are the best, my friend.
Well, thank you, Paul, as are you.
Well, thank you.
Well, thank you.
Keep it up back and forth.
I'm a bit surprised how sore I am. Even after I had a sex change, I was at the mall getting my hair and nails done 3 days later. And I can't even imagine doing any of those right now. Hi.
We're here.
Hi.
How are you?
Thank you.
Good, how are you?
Sore.
Sore where?
Where?
My breasts are still sore.
They are, sir. Well, let me tell you what I did. I started on the right, and I went down to the implant. The first thing I found was the implant was upside down. I kid you not. Completely upside down. It flipped. Yeah. You had 800 cc salines overfilled to over 1,000. Yeah. With the right one upside down. Yeah.
I knew something was up.
Yeah. Just want to see a quick look at my incisions to make, see this mark? That's where I sewed in the mesh.
I can't see anything.
You obviously are not bleeding. Everything's looking okay.
Okay.
All right?
Everything, thank goodness, looks absolutely perfect. And you look great. She wanted a more natural look, and I think we did it.
I have something for you.
Oh, my oldies.
They're clean and intact.
I'm thinking about sending them to my ex-boyfriend that wanted me to get them that large and say, you like these better than I did, so you can have them back.
See you very soon, okay?
Okay.
Okay, bye.
Hello, Kimber.
Hey.
Janet, good to see you, my love.
How are you?
Please just come with me.
All right.
All right.
Over the last 3 weeks, the doctors have been keeping a very close eye on me. I've been seeing them all weekly. Dr. Dubrow probably more than weekly, but maybe I spend a little bit more time there than I need to. But
Hi, Kimber. How are you?
I'm good.
Hi, Kimber.
Hello.
So I want to take out the tape. And let me look at this. Okay. All right, so your tip is not bad at all. Okay, I don't see much swelling.
Great.
All right, so we dropped your tip about 5 millimeters, by the way.
You nailed it. Looks great.
Okay, thank you, thank you. Overall, though, the profile, the tip looks perfect.
They exceeded expectations. Before my nose surgery, my nose was flat against my face and you could see straight up my nostrils. And now my nose is perfect and you can't see my brains.
How do your breasts feel?
They don't hurt.
Boy, they're so much better, smaller like this, aren't they?
So much better.
They look so much better, yeah.
I feel like myself again.
Really?
Yeah, I don't feel like a character anymore. Before, my breasts were ridiculous. Hard as a rock, they didn't move. Now they're the perfect size, 32 triple D.
So you still think, ideally, these are still a little big?
I think for right now, the stage in my life, they're good.
They're perfect.
But I definitely see myself going down in a couple years to probably like a D.
Kimber looks fantastic. She was hoping for a more natural looking result, and I think what we've done will go a long way towards achieving that goal.
Okay, so I need to see you in stirrups, okay?
My vagina is looking gorgeous.
Gave you more of a convexity here instead of a concavity. See, there's your clitoris in there. This is going to continue to soften up and become even more natural looking.
My vagina probably was able to heal so quickly because it's used to the pounding. You did amazing. Everything I wanted, I got.
No, thank you.
I just feel like less pornified. I feel like myself.
Hi, hard, scene 3 beta, take 2.
I'm definitely ready to exit porn. So after this last video I'm in, I just want to be done. Do you like everything?
Yeah.
My threesome of doctors properly gangbanged me and gave me just a perfect outcome.
So you're happy?
I'm happy.
I'm Charlotte Olhausen. I'm from Hawaii, California, and I'm your typical California girl. When I was 24, I got married to my husband, Will. We have 2 boys. They're 4 and 6. I'm 29 years old, and I feel like I have grandma boobs. I got my boobs done when I was 17. It was kind of like the cool thing to do. I was really happy with the results. I felt like they were a good size. They were like a C. I wanted them redone because after having my 2 boys, they were sitting a little lower. My first doctor retired, and the second doctor, he took over his practice. When I went in for my consultation, he said that once he got in there, he would know the size that I was supposed to be. I wasn't thinking. I just thought, okay, he's a surgeon. I just kind of did whatever you think is right. I never thought I would be a triple D, ever. I didn't even know that size existed. Within the first couple days, I started noticing a rippling and the changing of the shape. Now my breasts look like cow udders. I'm a daddy's girl. I usually tell him everything, but my dad has no idea that my surgery was botched because he bought a boat and he restored it, but he sold it to help pay for my surgery. I didn't want to upset him. I just felt like it was such a waste, and I felt really bad.
To the wedding.
To the wedding.
Yeah. No.
Lindsay's my sister-in-law. We're close. She's getting married, and I'm going to be one of her bridesmaids. I'm really nervous because we need to talk about the bridesmaids' dresses.
So I want to know how you feel about wearing strapless dresses.
Is that what you're thinking, the style?
Yeah.
Uh-oh.
I am.
I don't want her to pick a strapless because my boobs are an issue, but I'm not going to tell her what to pick because it's her day. Thicker strap over the shoulder works better for me.
Sports bra underneath it might not look too cute.
Yeah.
You can't wear a big old grandma-looking dress when there's 10 bridesmaids.
So if it's to the point where you can only wear sports bras,
Yeah.
then,
I will go with whatever dress Lindsay picks because I would not say no to her. I really want to get them fixed, my boobs fixed before the wedding.
Oh my gosh.
You think you can do that before?
I don't know.
We have Charlotte Olhausen, who had a breast augmentation about 12 years ago with saline on top of the muscle. And as a solution to the rippling she had from the saline, you can see the bag through the skin, the doctor put a pair of silicones in twice the size.
What was that doctor thinking?
He wasn't thinking that he was going to stretch the skin out and actually cause the problem to be twice as bad. The fact that it's cosmetic surgery and it's done to improve your looks doesn't make it different from any other type of surgery, cardiac surgery or brain tumor surgery, and like any other surgery, it can and does go bad.
Hi, I'm Charlotte Olhausen. I'm here to see the doctors.
Okay, great. If you want to sign in.
I'm feeling nervous and excited, and I'm just overflowing with like different emotions, hoping that they can fix me.
So, your breasts, you hate them?
I hate them.
Okay, and you hate them?
I don't.
You don't hate them?
No, I do. It's.
He doesn't get to. He doesn't see them.
The smaller we go, the more difficult it is to get things scooped up and lifted up because we have to cut out more and more skin, which means to remove more and more of the blood supply. And the more of the blood supply we remove, the greater the chance that we could basically kill the nipple.
Yes, I've heard that.
You know about this.
Yeah, where it turns black and falls off.
Right?
Yes.
So that's what
That's what scared me before.
That's what scares us too, right?
That's the dilemma right there.
Yeah. What are the odds of that happening?
It's on the list.
Okay. The chance that I could lose a nipple freaks me out. That is like the worst case scenario ever.
What if I told you to do this, we were gonna have to put scars around your areola, up and down the center of your breast, and all the way from the inside of your breast to your armpit.
If it fixes what's going on now.
So you're not running out of the room based on that.
Not yet.
That's good, that's good.
Okay.
Okay? Before we can determine exactly what the best plan of action would be, we need to examine you. Scars are worth it if the advantages greatly outweigh the disadvantages. Show us what, okay. Let's just open this up. Now, do me a favor, raise your arms up. Oh yeah, look at this. I think this implant's upside down.
Yeah, it does look like that.
It's upside down.
Can it do that in my body?
Apparently so, unless it was put in upside down. It's possible that with time and activity, the implant can flip over, but it's very rare. Listen, you went in for your last surgery saying you didn't want to be that much bigger, and he made you twice the size.
Right.
We're not going to do that. We're going to give you your goal, which is to make you a lot smaller.
I'm excited to have this behind me and be fixed, but I'm still nervous with some of the risks I'm taking.
You need something done. Your implant's upside down, it's damaging the skin, you're not in a good way. You have a good feeling about this?
Yeah. And guess what also? Today, you saw her breasts.
Hi.
Welcome to Alfred Angelo. And you're here for bridesmaids today. I see you brought it. Wonderful.
Yeah. The morning of dress shopping, I was really stressed. My stomach was in knots. I couldn't really think straight. I didn't even want to go.
What do you think about this one?
I need more, it's a lot of support.
We can add something thicker onto it, though.
Oh, like really thick?
Like sports bra thick?
Yeah, like that. We looked at a lot of dresses. We pulled a lot of dresses, but I was really not excited to try on any of them.
She's gonna have trouble getting something to hold her up. She needs some heavy-duty straps.
We're gonna have to put like 3 strapless bras on her because I like strapless. Sorry, no sports bras, honey.
I'm sorry, Charlotte.
I know.
I like it. You've got to get it fixed beforehand. There's just no way
Yeah.
There was just no support. They seem to hang pretty far. It just doesn't look good. Oh, it's Charlotte.
That's not bad. Still not holding you, huh?
Yeah. You're so low. I'm a lot older than you, and I think yours are hanging longer than mine.
Donna and Lindsay laughing. I don't really think they understand how much this actually hurts me.
I mean, that's not where
And you don't have a strapless bra on. You don't have.
I have a bra. I tuck the things down. No one else understands. I would never do that to somebody else.
I love
That's
it.
your color.
I love the color. I think this is gonna be the dress. I think we
Oh,
found it.
pretty.
Yeah. The dress.
Oh, that's
the color.
really pretty. The bridesmaid's dress is strapless. I'm hoping to get my boobs done before this wedding so I can feel comfortable in it.
You like it?
We can make it happen. We'll make it happen.
We'll make it happen?
Yeah.
Okay. I like
We'll
your
have to make it
positive
happen.
thoughts.
Yeah, we have to make it happen.
I like your positive thoughts.
Hey.
Hey, how you doing?
are you? How's everything?
That's all right.
I don't want to tell my dad what happened, but obviously he's gonna find out. You know how I talked to you about my second surgery?
Yeah.
It didn't go good. I haven't told you anything because I felt really bad because you were helping me pay for it. I feel bad that my dad had to sell his boat and that it didn't turn out like it was going to, and I just feel bad about the whole thing. It's getting fixed.
So that guy botched it that bad?
Mm-hmm.
Yeah. If you need anything, just like last time, just holler up. It surprised me that the operation did go bad. And I kind of wish I would have known a little bit earlier what was going on so she didn't have to worry so much.
The good thing is that it's getting fixed and everything's gonna be taken care of.
Now you're gonna make me cry.
Don't cry.
Yeah, I just feel bad that you went through that.
I know.
I'm not worried about the money. I just want you to be okay.
Yeah. Telling him is a huge relief, but I still feel bad. I think I'll be able to let go of it once everything's fixed. Love you.
Love you too.
Been wanting this moment for a while now. Here we go. Thank you. Good morning. Welcome. Good morning. I'm checking in. I am excited about getting my boobs done today, but I am really nervous that the results won't be what I want them to be.
Charlotte.
Hi.
How are you?
Good, how are you?
Good to see you.
Good to see you.
Are you excited about this?
I am, I'm so excited. I'm hoping that everything goes well with this surgery. I have kind of a deadline to meet with this dress for Lindsay's wedding.
Okay, so let's go in and make this work, make this beautiful. Let's fix the problem, okay?
Let's do it.
Okay. The plan for Charlotte today is to remove her old implant and put in a much smaller implant that's more appropriate for her body. We'll tighten up her breast pocket to fit the smaller implant and then perform a lift so her breast will be properly positioned. It's a bit of a mystery right now as to exactly what I'm gonna find inside. First thing we're gonna do is go inside the pocket and pull the implant out and see what position the implant is in and how big it is.
Got the section on, please.
So here's the implant. Charlotte's implants were very large. They were 600 cc implants, which is extremely large for a small person like Charlotte. See, it's upside down. This is the bottom. Ridge here was noticed. And when she bends over, you can see all this rippling in it. Got a very small muscle. Look at that.
Oh, wow.
So I don't know how much coverage I'm gonna get with that. It's unclear whether her muscles are actually big enough to cover a lot of the implant. And if they're not, you're not really gonna get rid of all of the rippling that you need to get rid of. Okay, now we've made the pocket smaller, we're gonna lift up the pectoralis major muscle. Charlotte has so little breast tissue that the implant will actually be the final size of the breast. So we went from a 600 to a 375, which I think is an appropriate size for her. So I had a critical decision to make with Charlotte. I had the implants downsized, placed under the muscle, and the pockets tightened. And so I sat her up. I realized that her result was actually acceptable at that point. In other words, no lift, no scars. But then I had to figure out whether that was an acceptable result for Charlotte. Let me see. Okay, so this is her without a lift. Charlotte has so little breast tissue that the implant will actually be the final size of the breast. I realized that her result was actually acceptable at that point. But then I had to figure out whether that was an acceptable result for Charlotte. But we still need to do the lift. After talking to Charlotte in great detail preoperatively, I thought that in her case, a fully lifted implant was worth the extra scars. Charlotte required a very significant lift, and she had a lot of loose, lax skin. I took enough skin out of her to line a small football, like a Pop Warner size football. Her breasts are now much smaller. They're about exactly what she wanted. They're up, they're symmetrical, they look good.
Okay.
You all right?
Yeah.
Okay.
Just hurts in my armpits areas.
Yeah.
Today I am feeling very sore. I'm tired. And I just really wanted to see if my nipples were okay. So sore.
Are you feeling sick?
No, you know.
No.
Last night I was in a lot of pain last night. I felt like I was going to throw up and just, trying to get comfortable and move around, like sit up, and just, it was hard.
Hey.
Hi.
How are you? How are you?
Good.
How do you feel?
Sore.
That's a really painful procedure, isn't it?
Yeah.
Yeah. I did a lot of surgery on Charlotte. She has a lot to recover from. She's got a lot of things that could be going wrong at this point. So I need to look for any signs of infection, bleeding, impairment of blood supply. I need to make sure her wounds are clean and dry and her nipples are alive.
I have a question.
Yeah.
Do you think that I'll be ready in a month to be able to be at my sister's wedding to wear a strapless dress? I have a question.
Yeah.
Do you think that I'll be ready in a month to be able to be at my sister's wedding to wear a strapless dress?
Definitely.
Okay.
No question about it.
Okay. It's a huge relief. I mean, that was a big stressor for me.
Okay, see, that's an alive nipple.
Okay.
And so is that. See, I think that'll be worth it. Look at this. That's no bra, and look at the upper fullness.
Yeah.
What do you think?
So far, so good.
So far, so good, right?
I'm happy with them. They're a lot smaller, which is exactly what I wanted.
Before surgery, Charlotte's complaints were that her breasts looked grandma-y with the implant upside down. There were all these ripples. She couldn't wear any clothing that showed the upper part of her breasts or her cleavage. But now, post-operatively, I think that any grandma, no matter what the age, would be happy to have Charlotte's breast at this point.
I'm just so happy.
It's exciting.
Thank you so much.
You're welcome. You're doing really well. So heal, lots of protein, high protein foods, take a pain pill, and just relax.
I can handle that.
Yeah, and go have a Lindsay Lohan moment.
How's that? Is that good?
Champagne, please. Today's the day of the wedding. It's finally here, and I'm wearing my strapless dress, and I'm feeling amazing.
Suck it in, honey.
When I first put this dress on, I had so much stress and anxiety and was miserable. I didn't even want to go dress shopping because I knew the outcome was going to be horrible. Now I feel so comfortable in a strapless. I'm so happy. It's a huge weight off my chest to feel normal.
Ready for Charlotte?
Yeah.
I know, you haven't seen
I know.
Charlotte.
I know. Where is Charlotte?
I'm not sure.
Hey guys.
Girls, look!
Oh my God! No, they look like the dress, everything.
Oh my gosh.
Charlotte's real happy. I think she's really excited the way everything went, you know, and I think it's gonna boost her confidence. Charlotte looks perfect.
Oh, remember the first time you tried that on?
It was
When we were at the,
She hated me.
the store.
Yes. Now I can go.
Now you can dance. I already let loose. Yeah.
My before boobs look like old saggy grandma porn star boobs. Now I feel amazing. I'm ready to go buy a bunch of strapless dresses and cute tops.
Cheers to Charlotte. Oh,
Hey, it's your girl Saaphyri. You might know me from some reality shows. Flavor of Love 2, Charm School, Hollin' in the Hood, I Love Money Season 2. I broke into reality. I became famous from that. But when you're a television personality, you're judged way more harsher than the average person. They will chop you down, cut you up, put you in the freezer, and bring you out the next day to finish talking about you. Yeah, it was hurtful. So I worked really hard. I lost a lot of weight, and my breasts, they deflated basically, because, you know, it wasn't no meat to keep them up. And then it was like, even though I lost weight, my stomach never lost weight. So I was like, well, if I get some liposuction here and plumping these up here, you know, then I'll look perfect, like a, you know, little chocolate Barbie. And I had did the skinny part on my own, so I figured, why not go ahead and get the rest of my hotness from the doctor? Went to this doctor because my cousin was like, oh, he's bomb, he's new girl, he ain't gonna charge you a lot, thinking it's gonna be good. After the surgery was done, he put this girdle on me. It had a piece of wire in it. It made an indentation in my stomach that just never went away. And then my breasts, I didn't think they were gonna be so huge. Then I gained weight, next started flopping around like some grandmamas, and I wanted to wake up with a new me. I woke up with somebody else, like in my breast, like a was living in my breast.
Mark, this is Saaphyri.
Great to meet you.
So nice to meet you. Sit. Do you want a water or anything?
Yes, everything.
We're a talent management company, represent actors, writers, directors, hosts.
I'm like well aware. I've written some things and brought you a couple of treatments. I don't know if I'm eccentric or, you know, what have you, but I see things a little bit differently. But now I'm branching out. You know, I write, I create. I want to host a show. I want to star in it, everything. I want to be that bitch. I want to actually have my idea permeate the screen, you know, and just let everyone see what I'm thinking inside of here. I need to have my breast be professional breasts, not stripper breasts. I don't want everyone to just stare down at my chest. I want them to look me in my eye for my own self. So I have that personal confidence, kind of like a guy who likes to wear women's underwear. He knows what's on underneath there. Nobody else does. That's what I want.
Pleasure to meet you.
Pleasure to meet you as well. Saaphyri is that boss, bitch. Yes.
Terry?
Yeah.
I hear we're seeing someone named Saaphyri?
Yeah.
Saaphyri?
Saaphyri, she's a reality star.
Oh.
Good day, Dr. Nassif, Dr. Dubrow. Here's Saaphyri.
Saaphyri, how are you?
Nice meeting you.
Dr. Nassif.
Nice meeting you,
How are
Dr.
you?
Nassif.
Terry Dubrow. All right, well, tell us a little bit about what has gone on with you plastic surgery-wise.
A few years ago, I lost a lot of weight.
So how did you lose that weight?
I did like this 3-day diet where you just eat ice cream at night and you eat the other foods during the day.
The ice cream diet.
Kinda.
No, I don't know.
I've never heard of that. Yeah, I like that ice cream diet. I think I want to get on that.
Tell us about the surgery you had and your experience with the doctor.
It was really spooky. I remember I woke up on the table and I felt pain.
So you woke up during surgery?
I woke up during surgery. I said something to him, and he actually told me to be quiet. I'm like, ow, and he was like, shut up. And I was like, huh? And so then I seen the anesthesiologist put something else in, so it made me doze off. I was still mad, like, he told me to shut up. There was one patient, and he didn't even take her to the hospital. He took her to his home. She actually died at his home. It was like on the news and everything. Her family was like really upset about that. So I guess he probably did that to someone else as well. And they killed him at a Frosty Freeze here in Los Angeles.
They killed him?
Yeah, he was murdered.
Wait, Frosty Freeze, don't they have ice cream there?
Yeah, they have ice cream at Frosty Freeze.
You weren't on the ice cream diet at that time, were you?
Oh, no.
So
Are you trying to say something?
Wait a minute. I feel trapped.
There'll be no ice cream post-op for her.
He was murdered, we think, by a patient?
I think he was murdered by a patient. I plead the fifth. I don't even want to talk about him no more. No, I was nowhere near that at all.
All right, so let's start with the chest, then we'll move to the stomach, yes? You have a lot of breast tissue. Your own natural breast tissue, right?
Yeah.
So you actually have to cut into around here to reduce the areola.
Oh, you were reading my mind. You were reading my mind. I swear he was reading my mind. Wasn't he reading my mind? Remember I told you just the other day, I said, I want my areola to be littler and cuter buttonier.
Okay.
Buttonier?
Yeah, like cute as a button.
Her breasts are far too big for her body, and her breasts need to be lifted significantly. Let's talk about the stomach. So this is where that garment cut into you.
Right.
This is really more about loose skin than it really is about the lumpiness. Your abdomen is a little full like this.
Is it because I just ate that steak burrito?
It could be. This is gonna be a difficult case because liposuction alone will probably just make her worse. She's gonna have to do a tummy tuck and have that big hip-to-hip scar. Here, all the way across to here. Pull the excess down and do some liposuction up here because it's still too full.
Yes.
That's a tummy tuck, and it's the fix for your problem. But I mean, if we do this and I give you scars, I just want to make sure, you know, if I'm in an ice cream store, that all of a sudden I look over my shoulder and you're not standing there, right?
I don't know, I might have a craving for ice cream. With my new boobies and my new stomach, not only am I gonna take the world by storm, they might even call me Storm because I'm gonna be a bad... You know what the doctor told me? He said that each one of my breasts are like 7 pounds.
Oh no, that's the sound. That's
I
like
got infants on my chest, girl.
Major
So what size are
boob.
you?
I'm like a 36 triple D.
I never really heard of triple D.
Girl, they got triple Ds. I think they even
Girl,
go to...
I was an I.
No, seriously. My mom was an H.
Is that like, dang, why can't, what's first, H or I?
H.
Really? Is it H? It's H?
H-I-J-K-L-M-N-O-P. You know what?
What?
We is not having no Jessica Simpson moments right now. Chicken of the sea. Put that areola up, too.
See, that's what I'm talking about. My psycho doctor was like, no, I'm not gonna just give you an implant. I'm gonna make your the size I want them to be. He
Well,
made them
then
the
he
size
should
he
have
wanted
paid for them.
Well, he's dead. Somebody killed him.
Probably because he up their boobs. Dr. Dubrow better get it together because we know where his office is.
Frosty Freeze, no, this job.
No, seriously, it'd be funny when you tell it, but it happened.
The
This is just gonna relax you a little bit. Do you drink it all? You probably don't drink it all, do you?
Oh, yeah, I do.
You do? You're such a good girl. I didn't think that you would drink.
Oh, yeah. Chardonnay, Merlot,
All right, well,
Hennessy, champagne.
this was half a bottle of Chardonnay and 2 Hennessy's, okay?
Oh, I'll still be dancing around the table.
Well, let's go.
Saaphyri is going to have a lot of surgery today. We're going to do 2 procedures on Saaphyri. First, we're going to pull out her old implants and replace them with smaller ones and do a nice tightening breast lift. For her tummy tuck, we're going to do a hip-tip incision, liposuction to tighten up her abdomen, and then remove the excess skin and stitch her back up with an incision below the bikini line. She wants to be a full C, but you know, the truth is, if you take these implants out and lift her, she's still going to be bigger than a full C with nothing. And if you cut out breast tissue and lift her, her nipples will die.
Let's not do that.
Oh, she has a ton of breast tissue.
Yeah.
Survey says 300. I was disappointed they were only 300 cc's, which means that most of her large breasts are attributable to her breast tissue themselves. So let's put a 200 in. The problem with downsizing her own breast tissue is you're cutting away blood supply and reducing the areola and limiting the possibility that they'll survive. So now we're performing the mastopexy, or what's known as a breast lift. We're removing the skin in a keyhole pattern that goes around the areola, off to the sides, and down all the way to the breast crease, and bring the edges together in a more upright or superior position. During the entire procedure, her nipples looked viable and alive. So I'm very pleased at this point. Okay, so the breasts are nicely lifted. They're very symmetrical. This is the best size we could get given her anatomy, and I think she's gonna be really happy. Okay, now that we've got the breasts lifted, we're gonna work on the abdomen. Okay, so first thing we're gonna do is make an incision. So we're gonna suction 3 areas. Those 2 bulges above the belly button and then the pubic area where she has some fullness. Saaphyri's major things is that she wanted her incision to be low. And this indent that she has across the center of her abdomen removed. So we're gonna do that by elevating up her abdominal wall skin and removing the segment of skin from the belly button to the pubic hairline, which will remove that dented segment that she hates. Saaphyri's abdominal wall on the inside was filled with scar from her previous liposuction. That adds a level of complexity to the entire operation. So we've elevated up the abdominal wall. Now we're gonna flatten the abdominal wall by sewing together her muscles. And the way to do that is basically an internal girdle. We put a stitch from the left to the right side, stitch it together, and that will narrow the abdominal wall. Normal, abnormal, hand cramp. Overall, Saaphyri's surgery went extremely well. It was very complicated, very long. I think this went really well. The breasts are in a good position. I think she's gonna be really happy. Isn't that a good belly button, by the way?
Yeah, the belly button's awesome.
Yeah.
Hi. I could be better. This week is like I'm kind of here, then I'm kind of not here. It's like a lot of laying around, just eating and talking to people and them not understanding exactly what I'm talking about.
Hi.
Hi, Dr. Dubrow.
How are you?
I'm okay.
Yeah. How's your energy level?
I'm sleepy.
Yeah.
Yeah, I'm sleepy.
Blows you out, this much surgery. You had a all-day surgery. Yeah. The thing I was most interested in with Saaphyri is that she's had a lot of surgery involving lifting up what we call flaps of tissue, which means you're removing and impairing a lot of blood supply. I want to make sure nothing is dying. Well, that's pretty great. Have you taken a look at the breasts?
Mm-mm.
They're pretty great. Wow. And you're making me look good. I like it. Because it's all about me.
Yeah, of course, of course.
Because if you don't heal this well, you know, I don't look good.
Yeah.
And
if you don't look good,
then we've got a problem.
Yeah.
Saaphyri's one of these patients that has great spirit and will heal really well. She went into surgery really motivated. She came out of surgery in a good mood. All of her surgical sites just look very calm and happy.
I'm like, really, they are.
What?
Usually, my areola would have been all the way over here.
Oh, I know.
And now it's like right there. That's cute. I have tiny little nipple areolas. Oh my God, girl, you look cute. Look at your It's just like, I want everything to be see-through. I want everything to be see-through for at least a year.
That hurt? Okay, good.
I feel my nipples getting hard or something, and it's cold, and that's kind of painful.
Your nipples are getting erect because
or
they're cold?
something,
That's
'cause it's
good. That
cold.
means they're alive and they're working.
Oh, okay.
That is by the way, that is the best news you can give me. I was so pleased because that means they're not only vascularly intact, they're neurologically intact, which is amazing.
Thank you.
You're welcome. You're doing
That
great.
is
You really,
Dr.
you really.
Dubrow.
Saaphyri looks like someone who's about 6 weeks out from surgery when in fact she's only 6 days out from surgery. And I attribute that to her spirituality and her great attitude and optimism.
Thank you, God, for my new boobies and making them look so cute and perky and making the incisions heal good and not keloid up. Thank you. I love you so much. I know you love me, and I'm gonna be good too. I promise. I ain't gonna even be bad. I'll be good. Love you. Can you also help me get my leg in here, Lord? Thank you. I can't wait to surprise my friends with my hot new body. I'm healed up, everything looks so good. So I told them, meet me in Beverly Hills, ladies. It's turn up time. Beverly Hills has no idea what's coming for them, but I have arrived.
So have you seen her?
I'm excited to see her, but no, I'm excited.
The limo represents long-term success, stretched out success.
The doctors was really cool.
Oh, really?
Yeah.
So how many doctors was it?
It was 2 doctors. One of them was fine, okay? But let's see they work.
Where would she be at? Like, really? Okay, it's getting late. We should probably try to call her.
Call her, quick, get your phone.
Hey, bitches! Come on, get in this limo, honey. Let's roll.
You look amazing.
Look at the girls. Look at the girls.
See, that sunroof was open. I had to pop out, just like Jack in the Box, but cuter. Get in the car. I got a lot to show you. Can't no Jack in the Box mess with this, honey. None. Saaphyri is here, honey, and she has a new body. So if she got a new body, she has a new mind, new spirit, new soul. I'm just like a new person.
So let's see them. I love them. They are perky like they're supposed to be.
Yes. It's all right. I'm like a 34 double D.
That's my dream size.
Before, my breasts were superhumanly huge, and the areola alone was like the size of an apple. Now, they're just so model-less, so pretty, so dainty. You would think flowers were falling around me just like I was in a video or something. I should be, because I'm cute.
I want to see the waist.
My tummy look good, look.
The indention is gone and everything.
Yes. Before, I was really self-conscious about my stomach because it looked like I had been like chopped in half. But now, my stomach is all one level. It might be still a little poked yet because I haven't quit eating yet, but it's beautiful. I'm so happy because that indention was like killing me. It was like so embarrassing to go to a beach or go anywhere where you have to show your stomach and you had that big indentation. It's like now my belly button is all cute. Even though it's not healed, it's only been a few weeks. So it's like a few weeks and it's like this.
Right.
You can
Imagine
only
what like the months are gonna be like. I think my favorite part of my new body is what it has done to my mind because I don't worry about my just jumping around. I feel like I could jump up somewhere, grab a pencil and a piece of paper, start writing without having to write like this.
Yeah.
I love it.
I bet you do.
I love it.
You feel relieved.
It's like my back doesn't hurt anymore. My front don't hurt no more. My shoulder don't hurt no more. My back is just like thanking me every day, saying, girl, why you didn't do this a long time ago? Thank you for getting that weight off of me. I was like, I got your back. Let's toast to the tatas.
When I was growing up, I didn't want a pony, I wanted boobs. Maybe it was like a boob freak. I had reconstructive surgery, didn't really go as planned. And now I have scars, and I got a tattoo of a lotus over it because it covers all the scars and it hides everything that went wrong. It's literally like someone took a scissor and cut off my breast. I grew up in New Jersey with a mother and a father that were amazing. My mother, she lived vicariously through me because she kind of made a little Jean Bonnet out of me. Because I used to sing and dance and perform. I was like an entertainer at heart. From when I was really little, it was when you get some boobs, we're really gonna dress you up. I would look down at my chest and imagine them. But I did get boobs, and they were freaking awesome. They were awesome. I mean, yes, they were. I used to never wear a bra. I was like, bam, this is me. This is, you know, here I am. Here they are. Got into places for free. I would have never thought in a million years that something would happen to me or my breasts. So in June of 2006, I found a lump in my left breast. I went to my doctor, and she did a breast exam. She indeed found the cyst, and then as she proceeded to do the breast exam, she found another lump the size of an eraser tip, which is usually the way cancer is found. I was just in shock. My husband and I, we were only dating about 6 months. This was a man that was like, I'm going down with the ship. And I was just dating him.
When breast cancer happened to us, we were crushed. And she came to me and
I was just trying to understand what breast cancer was, different stages, if I'm gonna have chemo, if I'm gonna lose my hair. I mean, really, I was like, I just wanna live. I just wanna live. So I was losing a breast. So on the morning of my mastectomy, I was introduced to a team of doctors. One was the surgeon, one was the plastic surgeon, one was the oncologist, one was the nurse. And so they all came together as a team to handle what goes on. So the plastic surgeon made it sound like everything was just gonna look exactly the same. He never brought up the fact that I'd be losing my nipple. I didn't even take that into consideration. They removed my left breast. The plastic surgeon came in right afterwards and put in an expander bag. And it stretches the skin and the muscle so that there's room to hold an implant. He slowly filled up the expander bag over the course of a year with saline solution until my left breast was the same size as my right breast. My husband and I decided to get married within that interim. I got married with the expander bag still inside of my chest. And then I had reconstructive surgery a year later. The plastic surgeon chose to put implants in both breasts. The theory was that they were gonna look symmetrical, so they were gonna be the same. To make a nipple, the plastic surgeon told me that it would actually be like a 3D protruding nipple, like a natural nipple. Turns out that the nipple was not 3D, it was kind of 2D-ish, and it was pretty flat. So when I woke up from surgery, I noticed that the breast on the left, it was flattened like a football shape and pursed behind my muscle. You can see that there's a situation right here, and even when I constrict my arms or do something, you can see that there's something moving here. This reminds me every day that something went wrong. So I just want to be me again, free. I'm really annoyed with this situation. It drives me crazy. I feel it all the time when I try to work out and be physical, and I want to just like rip it out and throw it away. I believe it's time. I mean, I'm cancer-free. It's time to make this better.
Cindy going in for another surgery is a godsend. When I saw Cindy's breasts after they had been reconstructed, I thought that it was a complete disaster.
Really, at the end of the day, this thing. I'm over it. It's beautiful to say now that I've come so far and I'm ready to just take care of the physical now.
So happy for you.
Goodbye.
I mean, you have no idea.
Good morning, Dr. Nassif, Dr. Dubrow. Here is Cindy and her husband, Billy.
Hello.
Hi.
Hi.
I'm Dr. Nassif.
Nice to meet you, Cynthia Lacoste.
I'm Terry Dubrow.
Hi,
Pleasure to meet you.
Billy, nice to meet you, Billy.
Thank you. Thanks, babe.
tell us a little bit about your story. What's been going on with you?
I had a really difficult time with a mastectomy.
You had breast cancer.
I did. I was told that I would get this great chest and it would look like nothing ever happened. It definitely looks like something happened.
So the doctors said that after the reconstruction, that they would look perfect.
Perfect. It actually does not look symmetrical at all.
How long ago was yours diagnosed?
It's been about 6 years, 6 or 7 years.
Okay, good.
So you passed the 5-year mark.
I passed the 5-year mark.
Cancer-free.
Cancer-free. I'm good to go.
Congratulations.
Yes,
there we go.
thank you.
That's the big news right
yes,
there.
this is the big news.
Thank God that she's cancer-free after 5 years, and that's the magic number.
What about the nipple on the left? What did they do for that?
Oh my goodness. When the doctors reconstructed a nipple, I hated the way all the scars looked. And because it looked so awful, I got a tattoo of a lotus over it.
Camouflage. That's not a bad idea, actually.
How you been doing through all this?
This is something that's for her because it bothers her.
But, you know, when we're intimate, it's uncomfortable to think that, what is he, in my mind, what is he thinking? What about how it feels? It's awkward.
We need to go have a look? Okay. That's good. Let's go.
Now's the perfect time to do the second surgery. She's cancer-free, she feels good, and now it's time for a little bit of an improvement.
Put your hand on your hip and push. Flex.
Yeah, so that's
yeah, so
they both are.
Yeah, they're both doing that abnormality. And see, look at this. You can see how she kind of has this connection between this two, this webbing. They're just a little too close together. I mean, this breast passes the midline here. See this? It comes across to the other side. I would consider tweaking both.
Okay.
I would. We really have to operate on both of Cindy's breasts. The right one is really sort of wide, the nipples pointing to the armpit. It's too low. It has a strange shape. It has no upper fullness. And the reconstructed side is a complete disfigurement.
And the tattoo will stretch out.
The tattoo will change shape a little bit.
As long as, like, on a daily basis, I don't have to feel uncomfortable, feel pain.
Right.
You know, and I can put on a shirt and look normal and not have to wear a ribbon saying, oh, I'm a breast cancer survivor, that's why I've got a messed up looking chest. I would love a symmetrical situation so that I can feel comfortable wearing a bikini. But, like, I don't care too much about the tattoo if it's gonna mean that the breasts are...
Tattoo would be good.
Yeah.
Tattoo would be unaffected.
Thank you so much.
Oh, you're welcome.
Thank you.
This should be
It's
really
our pleasure.
good. Yeah. All right, so we're gonna let you talk about it, think about what we've discussed, and then we're gonna take it from there, okay?
Okay.
All right.
The first surgery was kind of to save her life and kind of put her back together. This one, hopefully, is the one that gives her confidence back.
Hi, how are you?
Good. Cindy
You had the
Lacoste.
surgery? Great.
It does feel a little surreal for this to actually be happening right now. I've been waiting and waiting and waiting for a long time. Ever since the surgery years ago, I thought, how am I gonna live like this?
Are you nervous?
I'm super nervous, but it's gonna be good.
How do
Are
you
you
feel?
nervous? Are you nervous?
A little kind of excited, I guess.
Yeah.
This means the world to Cindy. She's been putting this off for a long time, and hopefully in the next few hours, her life will change, and I'll have my beautiful wife back.
What?
Cindy got breast cancer at age 32, which is very, very young. So her chance of another breast cancer is extremely high. So when I'm in on the right side, I'm gonna do a very careful examination to make sure she doesn't have any cancers there. And if she does, I will be able to find them very early. The plan for Cynthia's surgery is first to remove the original implants and assess her size. Secondly, I need to make the mounds more symmetrical. On the right, I need to raise and tighten it, and on the left, I need to open up the pocket and lower it. I will then put in 2 new implants, giving her even and more natural looking breasts. So first thing we're gonna do is open up the right breast pocket and see how big the implant is. Look at this cyst. Look at all these cysts. Boy, she's got a million cysts in here. Look at this. Cysts everywhere. Blue cysts are a normal, benign anatomical feature you often see in women's breast tissue, and it's really nothing to worry about. Okay, so what size do you think this implant is? I'm gonna say it's a 325. It is a 350. Ooh, it's ruptured. Once I made the incision on the left side, I immediately realized it was grossly ruptured. It was basically an exploded breast implant.
Ooh, that's really bad.
So this has been ruptured for a long time.
Yeah.
It was fortunate that she had the surgery, because when an implant ruptures, you want it out of there because it can clog up your lymph nodes and start migrating throughout the body. Okay, so this is the big implant for the mastectomy side. When you do a mastectomy or breast removal, you take all of the breast tissue, 100% of it, then replace with an implant. The problem with Cindy is that the implant that was used to replace it ended up rupturing, so this is a very tight breast pocket around a ruptured implant. Okay, can we sit her up? All right, well, the mounds are very even. The sizes are definitely even. And I think we can close. Cindy couldn't feel good in a bathing suit or even a bra. Now, I've got them even. I've got nice separated cleavage. She doesn't have a uniboob anymore. It's a very good reconstructed result.
It looks really nice.
We did absolutely everything. She should be happy with this.
He said I wasn't gonna feel pain.
You knew you were gonna feel pain.
Yeah, a lot of people go through pain.
You'll be fine.
Thanks, babe. On a pain scale of 1 to 10, I would say it's an 8.5. It's pretty intense.
Hey, Doc.
Hi, how are you?
Hi, Dad.
Well,
You said I was not gonna feel any pain.
I lied. I do that sometimes. No, I'm kidding. Is it terrible pain?
Pain?
Are you taking your pain
No.
medication? No, what?
No, I didn't take any. I took it last night, and it made me loopy.
So you had 3.5 hours of surgery, took no pain medication, and you're asking me why you're in pain. The fact that Cindy was complaining of pain and that she didn't take her painkillers, and that sort of surprised her. But, you know, sometimes the treatment is worse than the disease.
I'm in so much pain right now.
Really? You have to take a pain pill
I
after surgery.
cannot.
You
It
have
makes
to.
me
we have-
sick and crazy.
All right, well, okay. I'm gonna write you for a cocktail of medications you can take that is gonna make today much better.
When I get loopy on pain medication, it gives me energy, and I end up moving furniture and doing dishes, things that I wouldn't normally do. I actually want pain medication that, like, knocks me out. And I heard that I had a ruptured bag.
On your right, it wasn't ruptured. On your left, it was really badly ruptured. I mean, destroyed, exploded. I couldn't even identify the shell till I pulled everything out.
Wow.
And so it was just a bunch of gooey silicone that I was able to completely get out.
I would have gone and continued to live like that for many more years. I probably would have never found out if the doctor hadn't discovered it.
See how that separation?
Yeah.
That's a normal separation, okay?
That's
There's a tendency to want to evaluate the results
I'm not doing that.
12 hours after surgery, because
No.
that's how far out you are from surgery, 12 hours. See, now you can see that. Now take a look. You can take a peek. What you were noticing before I pushed this implant down, this was higher. You were noticing that, right? Just then, right? Does it look better now?
I don't think it's ready yet, so I'm not gonna look. I'm not even gonna try to judge what it looks like.
Every surgical maneuver you can do in breast surgery, I did. Every single one. So I got them, I think, very even. We are worried about the pain and the recovery the next couple of days because you won't heal well if you're in a lot of pain. So I'm gonna write you for some good stuff. Yeah, I'm gonna be your bartender. I'm your surgical bartender. Okay. You should have an enjoyable next couple of days. Okay? All right, you're welcome.
Thank you.
Bye, Doc.
Sure, bye.
I'm so excited to wear a bikini today and show my friends my new body. I got my confidence, my sexy back. No more scarves, no more necklaces. I'm free.
I'm sure she's on a cloud right now. I'm sure Billy's on a cloud as well.
Exactly.
2 clouds. Right, right, 2 clouds.
Oh, there she is.
Wow, gorgeous.
Oh, see the size?
Yes.
Wow.
I'm so super excited for Cindy. She looked absolutely amazing. I might need to get them done myself. Dr. Dubrow?
How does it feel like being in a bathing suit? Is it just...
It feels great. And look, they're the same. They match. Before my surgery, the right breast was kind of misshapen and the nipple was in a weird position. The left breast was kind of shaped like a football. There were quite a few scars. And in the middle, I kind of had a uniboob. And after surgery, my breasts are normal again. There's no uniboob. There's not a lot of muscle constriction. They're symmetrical. There's no rupture in silicone running through my body. You know, I can just
throw on a regular bra. It's amazing. Feels so much more comfortable, and it's just such a relief.
Compliments to the artist. I mean, the surgeon.
You're glowing now.
I heard it.
My wife looks so hot. I'd like to thank Dr. Dubrow for giving her sexy back.
How did they feel, Billy? Billy, how did they feel?
It's a good swollen.
I really have conquered so many things. I'm empowered to just be myself and have what reflects on the inside now be on the outside.
So I'm gonna take all the bras and all the forms, and we're gonna burn the bras.
Burning up the bras.
My breasts look horrendous. They almost look like if I was like part alien. My whole life, I've always been very insecure with my body. I've always been flat-chested, having guys making fun of me, telling me I had a dream I had sex with you and I woke up touching the wall. I mean, I didn't feel like a woman. I felt pretty much like a boy. 2004, I decided. I went in for my surgery. I was too excited, so I just found the first person online and I just got him done. I woke up and I wasn't happy. They were really hard and round. I did go back in. Doctor said, if you want to get resurgery, it's going to cost another $4 grand. And I knew I could not afford that. So I did stick with those for 10 years. Hi, baby.
Little baby.
My boyfriend, Eric, I met him 2012. I love him more than anything. I mean, he's so optimistic, warm-hearted, funny, genuine.
She loved life. I mean, the first time I think we laughed pretty much throughout the entire date. People probably thought we were drunk at noon. That's why I fell in love with Salina.
I remember the first day I took off my shirt in front of him. I just kept covering. He's like, why do you cover so much? And I'm like, I don't know. I didn't want to tell him that. I was really insecure. And I'm like, that's it. Like, I'm not going to go through this anymore. I'm not going to be afraid of being intimate with my boyfriend.
When she had her second surgery, I didn't really think that she needed it. And she kept telling me, you know, this is to please you. I want to make sure that you're happy with me. And I told her, like, baby, I love, you know, your breasts the way they are right now.
And I was so excited. I wake up from surgery. I couldn't wait. I went home, I took off the bra, and I mean, it was horrible. They were just like this. Every time I looked in the mirror, it just got worse. It's just like, wow. Like, I mean, I might have this deformity the rest of my life.
So I got a tweet from England about me that says, is it weird that I find Dr. Dubrow attractive? Why is that weird? Why do all the tweets that I get that talk about whether I'm attractive or not, why do they have to qualify it with the, he's not attractive, but I weirdly find him attractive?
It's like one of those, like those dogs that are ugly, but you find them cute at the same time?
It is like that.
Oh,
which is,
I think that you're very handsome.
You know what, I want to check your Twitter account. Could you imagine if they say that about me and what they must be saying?
Yeah, they say I'm beautiful is what they say about me.
Oh, here it is.
That's on my Twitter.
What does that mean?
Do I have more Twitter followers?
How many Twitter followers did you buy, or do you have?
Great day, Dr. Nassif, Dr. Dubrow. Here is Salina and Eric.
Hello.
How are you?
So nice to
Terry
meet you.
Dubrow, nice to meet you.
Eric.
Eric, nice to meet you.
Terry Dubrow, nice to meet you.
Eric, you just
Pleasure,
broke
sir.
my hand.
Sorry.
Yeah, Eric, you need to work out.
It's a good thing you have to reconstructive surgery.
You've gotten out of shape, I want to tell you. My first impression is Salina looked like a gym rat. Incredibly fit, low body fat, and very intense. So are you guys married or boyfriend, girlfriend?
Boyfriend,
girlfriend.
Okay, how long you guys been together?
A year and 3 months.
So what I'd like to know is basically, what can we do for you?
Oh my goodness. I've gone through so much. From back in 2004, I've had nothing but horrible surgeries. I wanted to make them fuller because I was flat-chested.
So you had no breast tissue at all? You had nothing?
I have very, very little. I mean, I'm sure I have some, but always had doctors say, you are very thin and you are gonna be kind of difficult to work with. And I'm like, and that's never good to hear that.
Right.
10 years of living with horrible boobs, and right now I'm actually more concerned in them just being proportioned and just pretty looking.
So smaller is okay?
If you're talking about going back to A, no, but that would actually make me cry just thinking about that right now.
Should we go do a physical exam and see what's going on?
It would mean the world to me if I could get my breasts fixed. I want them to be non-ripply and just even.
So put your hands on your hips and flex, push. There you go.
Yeah.
Okay, so you do have some contraction when you push. This crease is about an inch lower than this one. Salina's breast implants look really unnatural. The skin is so thin, if it weren't for the scar tissue, you could read the label on the implant. good news is you have capsular contracture. I know that normally isn't good news, but in your case, that capsule, that scar is our best friend. The number one complication of breast augmentation surgery is capsular contracture, which is basically surrounding of the implant with scar tissue. What it did was it thickened up your breast tissue. But we're gonna use that scar tissue because it's thickened up your skin.
Yeah.
Someone like Salina, who has very little breast tissue and a wide breastbone, you really are gonna always have a kind of a significant separation between the two implants. So what I wanna go for is even, natural, pretty. I think we might be able to achieve the same size. We can sew in some mesh material that would allow some scar tissue to grow in. The one thing you have to be willing to do is give it time for the scar to grow in. It's not like you sew in the mesh and it's done.
So it doesn't show right away then?
It'll be better right away, but it'll take time.
To me, good is gonna be perfect.
You guys are a great couple together.
Yeah.
Thank you, sir.
Look at this guy, kind of loving he is.
He is very lovely.
That's how he is to me.
Would you take him to the gym? Because it's not getting better. It doesn't look good.
That's the spot.
Nervous but excited.
Yeah, this is it.
It's finally gonna happen, this big surgery. Lifetime changing, I think, for me.
Yeah, I've kind of missed the girl that I initially met. But...
Well, I'll be here. When I wake up, I think we should definitely celebrate. Well, of course, I have to heal first.
The last year that she's been dealing with this, it's been kind of like an up and down roller coaster. One day she's happy, the next day she's sad.
I'm gonna take you back. I'm going, okay.
Yeah.
Bye, I love you.
Bye, baby. I love you. I'll be right there when you get out, okay? So for me, her being fixed is just hopefully to get the girl that I met back. The happy-go-lucky, fun-loving, let's go anywhere, do anything type girl.
Hello.
Hi, Salina. How are you?
Doing awesome. How are you?
Good. Good to see you. Are you nervous?
Very.
Well, let's try to calm some of those fears by going over everything in detail. Salina's the classic example of it's a scalpel, not a magic wand. A really good result may not be good enough. I don't, 2 months from now, want you to say, wow, they were great 2 weeks ago.
I know.
But look, I'm developing capsular contracture again. The fact that you did it with this one means it can come back with any of them.
But to be honest with you, there was a few things I did in my last surgery. I took off the bra right away, and I didn't finish my antibiotics. I tried on bikinis like the very same day I came. That's probably, do you think that could be contributed to why it happened?
No question.
Then maybe it won't come back then.
Exactly.
Because I caused it.
Exactly. Telling your doctor the truth is always a good idea. So maybe we'll just put you under anesthesia for a month. You take off the dressing and you start moving the implants around, bending over, looking and seeing if there's rippling in the mirror. You can cause bleeding and a surgical emergency in the middle of the night. And you know what? I got little kids at home and a wife in bed. I don't want to get up to take you back to the operating room because you're bleeding because you're not following directions. Okay, so we have opposite problems with each of the breasts. The left breast is high and hard and encapsulated. The right breast has no scar tissue and is low and out. For Salina's surgery, we're gonna take out her old implants and reshape her breast pockets to try to make them even. I'll add some mesh to strengthen up her breast tissue and put in 2 new implants. When we're done, she'll have 2 symmetrical breasts. Look at that. Nothing. She has nothing.
535.
Whoa, whoa, whoa.
That's
slightly
humongous.
I was actually surprised that the implants were larger than I thought they would be because what the implants were her entire breast volume. So the fact that she has essentially no breast tissue makes this a lot more complicated because I'm not working with breast, I'm working with scar.
$535.
Whoa, whoa, whoa.
That's
slightly different than...
humongous.
What did she think she was?
She thought she was a 390. Look at that, nothing. She has nothing.
I had more breast tissue.
That's right, Dr. Mest has more breast tissue than this patient.
I also have man boobs, so.
I'm going to do what's called a capsulorrhaphy, which is to stitch up the pocket from the inside, which will allow it to be raised and brought towards the center. Could you give me a piece of mesh?
Yes.
I put mesh into people who have very thin skin. It's like adding a lining inside of a coat. It thickens it up and makes it so you can't see the inside contents of the pocket. Let's put in 550 cc smooth silicone implants. I think despite the fact that her goals and expectations may be a little unrealistic, I think I nailed it. Does it look good? Does it look good?
Looks really good.
Yeah, right? It's looking really good. Let's close. I warned Salina preoperatively that she might have to go to a smaller implant and that I determined what's required to get her a good, safe, comfortable result. So I'm really pleased that I was actually able to go a little bit larger.
Hey, baby. When I saw Salina after surgery, it made me happy that she was obviously still there, that everything went good. I don't know, I just missed her being away. As corny as that sounds, I know it was only 4 hours, but I was like, oh, there's my baby.
Do you have any questions?
The one thing she mentioned is like, oh, I'm gonna try to shower tonight. I was like, no. I'm like,
shower tonight?
No shower. And she's like, maybe I can just put like a bag over. And I was like,
okay, yeah. Are
no.
you really?
Yeah.
Okay,
yeah,
absolutely not. Nothing.
Stick to it.
All right, thank you.
Thank you.
All right, my man.
Baby. Oh, there's the scrunch face.
Here to see the doctor.
Okay, great. You can sign in.
I am feeling ecstatic. I'm just dying to put on a bikini. I know I have to wait, but I'm just dying to see what they're gonna look like, and I'm looking forward to it.
Looking good.
Well, hello there.
Hey,
hello,
how are you guys?
Oh, very good.
Good.
A lot better than last time.
I bet, huh?
Less pain, everything good.
When Salina admitted right before going into surgery that she didn't follow directions with her original surgery, that worried me that she was going to be non-compliant with me post-operatively. No signs of encapsulation.
Oh, good. That's very good to hear.
We have to keep a close eye on things because what could go wrong now is bleeding. And if that happens, one of them will swell up like a football and be bursting out of your chest. Best way to prevent a complication is do the right things post-operatively and identify a complication very early and treat it. The other thing can happen is an infection. It usually starts as redness, and then swelling, and then warmth, and then pain, usually in that order. Are you still on the antibiotics?
I'm almost done with it.
Okay.
Well, I'm so, yeah.
You get a breast implant infection, it starts to spread throughout your body, it takes over your immune system, and we have to take the implant out, and you walk around with nothing.
I would die. I am worried about getting an infection. I mean, I might have to undergo surgery again, or having to take all these other medications definitely freak me out. So yeah, I'm a little bit worried. Actually, a lot worried.
And I'm like, you gotta take these antibiotics. I'm like,
I
if
just
you
wanna
don't,
take
I'm like, it's gonna be bad. She's like, how bad? I'm like, bad.
He told me he'd love me no matter what. He's like, I love you with boobs or no boobs.
By the way, I believe that.
Yeah.
And I don't even believe he loves you more with better breasts. I don't believe that. I think he loves you the same.
I'm sure
I think
that
he
loves me more.
Well, that's besides the point.
He's got a mind of his own, but
yeah, we're not talking about that.
Okay.
But I promise you, he loves you when you're happy.
Yeah, he notices that. He's been noticing that too.
Yeah.
I feel that after this whole surgery, it made me realize that my boyfriend Eric loves me to death no matter what.
You have any questions, issues? You text me, because happy patients get happy results. All right, you guys are great. Thank you.
Awesome, so
Good
much.
job.
Thank you.
You're welcome. Hey, my pleasure.
I could never imagine going laundry shopping before. I mean, every time we'd go to the mall, Eric would say, like, let's go look at this cute outfit. It's lingerie, it's so cute. I'm like, no, I would not, because before, to put on lingerie is something that I usually used to dread. I have to wear like tons of pad and always having to just make my breast proportionate. And now, I mean, I just feel super sexy. My boobs look amazing. I feel like I look like a supermodel. Hey, baby.
oh my God. Who are you and what are you doing with my girlfriend? When I saw Salina come out of the dressing room, I was completely speechless. My girlfriend is smoking hot. I have not seen her look that sexy and be that confident with the twist and the twirl and the moves and everything.
You like it?
Yeah. God, but you look sexy.
Eric is falling even more in love with me, not because I look sexy, which I know I do, but I know that he sees his whole new me. He's noticing that instead of my head down, I'm actually looking up when we're walking and feeling like alive again and sexy. And I know that he loves me just as much as I love him, and one day we'll definitely be married. I think it looks great. I feel so confident. You have no idea. I'm gonna be probably wearing this to bed like every night. I think we're gonna have a lot of.
That's fine with me. That's fine with me.
Before surgery, my breast looked and felt horrible. That was like lopsided. It basically looked like I was always just tilted over. My breasts right now are full, they're symmetrical, there's no more capsulation, there's no more rippling, and they're just amazing. Thank you so much, baby.
Of course, baby girl.
I love it. We need to get these new boobies. We gotta show them all off.
I'm just happy to see you happy, baby. I have seen a huge change in Salina's confidence, like probably 5,000% increase, I kid you not. It was so nice to see that, number one, she looks that gorgeous, but number two, that she loves who she is now.
Thank you for all your help. Thank you
Let's get
so
home
much.
and go put this sucker on. Let's go.
So now that I have one, can we go buy you a Speedo? I'm barely there.